All right, welcome back. And we want to get into this conversation. I'm sure you are very well aware of the various happenings in the country. We're talking about vaccination, those who are coming in, going out, having to vaccinate before they do so. And then, of course, there's also been news from the Ghana Health Service that the cases are fast rising again. And we haven't even gotten into the thick of events, for the Yuletide. Of course, there's been a few events. My colleague, Duke Mensah Opoku, has joined me in the studio. Let me pick his thoughts quickly, and then we'll go and look at a quick report on the rise in the figures. Duke, how are you?
Oh, well, I'm well.
Yeah.
I'm good health, good spirits.
You're easing into the Bronya.
Oh, yes. It's already with us. It's only the difference is tomorrow, 24 hours.
Yeah.
So it's good. We're here.
Yeah. What do you make of the situation so far? As far as I know that there's been a lot of agitation as far as the mandatory vaccinations are concerned, even to the point where the Samijevy is looking at taking the GHS to court regarding the fact that there's no executive instrument and all of that. What do you make of where we find ourselves at the moment?
It's unpleasant to notice that the numbers are rising by the day. It was just last week or 2 weeks ago when the president addressed the country and sort of painted a picture of where the country was. And looking at the numbers, we're on a downward spiral in terms of the figures and the people who had been affected. I mean, infection rate was going down. Then all of a sudden from Monday, it's been going up. And just within the last 24 hours, about 321 new cases recorded. It's not what we would have wanted, especially as we go into a very, very busy season for human interactions. We are thankfully, we know where the majority of the cases are coming from. Majority of the cases are imported. We're told averagely about 200 cases are recorded at the airport, which is sort of a closed environment where there's the best of equipment to do detection. What we have to do is to ensure that they get the required treatment. I mean, if they have to be vaccinated, they are vaccinated. So I don't get into the larger population, the larger society. And for those who are coming from outside, we don't know the kind of variant that they are bringing. In. It's also unpleasant because last year a lot of people let their guards down. And we got into another wave of the infections that only went down somewhere around March, April. So from December right up until that time, the numbers were rising up until it started coming down again. And then here we are with all the warnings, even before the main Christmas season will kick in, we have the numbers going up. I think it's two things. It gives us
a forewarning,
really. To be a lot more cautious, very, 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 very cautious with the protocols, with the, social distancing, with the mask and all of that, whether you are vaccinated or not. Because I mean, Israel has one of the highest rates in terms of but they are taking their 4th booster shot now. 4th.
Wow.
Yes, number 4 booster shot. Not vaccines. 80% of the population is vaccinated. But they are taking boosters 1, 2, 3, 4. This is the 4th time that the 4th rollout of a booster. That's what is going on there. And we have even banned them from coming into our country. There's a travel ban on persons coming from Israel coming here. So that should tell us, even if a country that has 80% vaccinated and they rolled out one of the most seamless vaccinations exercises everywhere in the world, and they are now on their 4th booster shot rollout. UK is doing a similar thing. So, we don't have the resources, the scientific sophistication, and even the kind of public health infrastructure that these countries have. So what we can do is to apply the basic scientific common sense principles that we've known all across. That's number one. Number two is to take the vaccination seriously. Because I mean, we have over 20 million vaccines are in the country. We've been able to administer only 6 million of them, and
many of them are just single shots for vaccines that should be a double shot vaccine.
Yes.
You know, so it's problematic.
Yeah.
Where we find ourselves. There's a number of things that occur to me though when I'm thinking about what's going on right now. In so far, we have been let off the hook largely on the continent of Africa. You know, it seems. Maybe perhaps due to some of the protocols we put in place, but also I think that is some form of providence in the sense that looking at there's a correlation between vitamin D production, you know, and immunity, you know, and that seems to somehow be an indicator, you know, in all of this. Because if you're talking about Israel, for example, I mean, they're in their winter months already, you know, and it seems as if winter seems to create a natural spiking, you know, because all the winter countries are having the same experience. All the winter countries.
Yes. So yeah, the weather plays a great part. We are told it plays a great part, but we should not bank our hopes too much on it.
Particularly also because the Harmattan is extra severe this year, which means a number of things. Blockage of sunlight comes with Harmattan. That's one. And number two, the temperature also drops. You know, with Harmattan. So
hazy weather, because even without, I mean, COVID, people would experience certain signs with the blocked nose, coughing, flu, and all of that. With the with the coming or with the onset of the Harmattan, coupled with COVID, which is also in the year. So it's just a warning to take the protocol seriously. And if you've not vaccinated to your, I mean, thankfully the GHS says this is called vaccination month, and they're doing everything possible to do a rollout of the plan across the board, across the country, moving to places that they need to move to get people vaccinated. And I think as many people as possible should take advantage. If you don't have any condition that suppresses your immune system, any immunosuppressive, I mean, ailment or anything like that, even that, I'm told there are certain precautions that can even be taken so that you can protect yourself against what would come. But apart from that, so far, the number of people who fatalities suffered as a result of that is, I mean, every life is important, but if you do the comparison, if you do the analysis, but this should also get to the GHS to be thorough with information and other things that they take before they give up, because nobody should lose their lives taking a vaccine. And the more that goes up, the more it will strike fear in people's hearts. But if you do a comparative analysis of the cases that, I mean, fatalities associated with taking the vaccination and the number of people who have taken the vaccine and they don't have any complications, or they are alive and up and kicking, up and running, it's largely safe. So, I mean, why do you put yourself in a situation where you'd be in a compromised position in terms of getting the virus and the rest? And people think that, and I think that needs to be put out there very clearly. Taking the shot doesn't mean that you will not contract the virus. It only means that
it reduces your chances of a fatal condition.
Going down with severe symptoms and possibly dying. It only prevents that. It means you can catch it again, but when you catch it, you won't show serious symptoms and you won't die, because your immune system has been boosted against, I mean, this virus that the whole world is trying to fight against. Another thing too is that we are not lucky. I mean, yesterday the Chancellor of the Exchequer in the UK just rolled out a plan for businesses. Almost £1 billion will be given to businesses. We don't have the luxury of that in this country. We don't have that. So what we can do is to apply the basic principles, so that in as much as we are limiting the movement and other things, people can still go about, because there are people in this country, like 3 weeks of lockdown, we saw how fragile our economy is. How people used to line up at the children's park, waiting for 12 o'clock when the food packs will be brought to them. We went into what used to be Sodom and Gomorrah, how people, I mean, would queue up, would line up from about 10 a.m. up until 12:30 when the food would come. It means that, I mean, if we find ourselves in a lockdown, I mean, we saw the pictures in Europe where on shelves there was only, I mean, tissue paper
that was left.
That was left.
They cleared
so
all the shelves,
everything. So we should all try and work towards a situation where there wouldn't be another lockdown.
Yeah.
Another lockdown, because there are people, if they don't move, they will starve in this country. So let's all try and manage the situation as we've done. If you have to take the vaccine, I mean, take it. If you've taken it, still do not abandon the protocols. Your mask, your social distancing, washing your hands, especially and this one thing I've noticed, a lot of these public places that would require you to have masks on. These days are gradually the banks, the restaurants, and the shops are abandoning I don't know if they are tired of putting water and soap there in the tissue.
You're right.
It looks like that is gradually becoming a thing of the past. You see that there's no water in the barrel, in the Veronica bucket, or there's no tissue, or there's no
usually
soap.
I mean, what I find is that the bucket that will be there, the Veronica bucket will be there, but there will be no water.
There's no water
or there's no soap.
There's no soap. The alternative to that, we are told that's the best. Washing the hands is the best.
It is the best.
The alternative is the sanitizer.
Alcohol-based sanitizer.
But you get to a place, and I was shocked. A pharmacy.
And they don't have
pharmacy.
Yeah.
There's no sanitizer. There's no water and a soap with tissue for you to wash your hands before you. That's for the no mask, no entry, no mask, no entry. Yes, that one. I will give a lot of props. It's being maintained. It's going on. But the water and the sanitizer, it looks like we need to go back to those days, especially now that we're trying to prevent a fourth wave, because consistently, if we're having 200 cases even alone from the airport over this period.
But those 200 cases will quickly turn into something else.
Yes, because we are told the Omicron, even though the symptoms are mild, it spreads faster, like way faster than Delta. So we need to
speaking of upsurge in cases, let's take a look at this quick report. We'll come back and continue the conversation.
As part of its last council meeting for the year 2021, the Greater Accra Regional Coordinating Council provided an evaluation and review of the performance of metropolitan, municipal and district assemblies in the region. In a statement delivered by the Vice President of the National Development Planning Commission on behalf of the Greater Accra Regional Minister Henry Quartey, the RCC bemoaned a surge in the daily COVID-19 cases recorded in the region in the last 3 weeks and urged the public to strictly adhere to the safety protocols despite their vaccination.
Daily reported new cases of COVID-19 within the region was at an all-time low, at an average of 10 cases a day. In the months of October and November 2021, however, in the last 3 weeks, the daily reported cases of COVID-19 has increased to an average of 80 to 100 new cases daily. Currently, the region has recorded 71,351 confirmed cases, with 70,325 of the cases recovered and 722 cases currently actively ill as of December 18th, 2021.
All right, so that's the report we have there for you. And Abioko, good morning.
Bonjour.
How are you? Oh, bonjour. Oh, bonjour.
Right.
Bonjour. Comment ça va?
Ça va très bien, merci. Et toi?
Oh, merci. Yeah, Duke. Hey, okay.
Exactly. You're the lost cause.
So guys, listen, this is the situation that we find ourselves in, and it seems like, I mean, what the comment you made there about the rapid rate of spread, and before we took the report, I think it's a critical factor to what we're experiencing, what we're seeing so far. I think it's important to mention that, yes, it is true that it doesn't seem to be as fatal for now. Reports coming from China, reports coming from other European countries, it doesn't seem to have the level of fatality as a Delta did. But the spread is ridiculously faster. I mean, I hear about some people even say as much as 70 times faster.
Exactly.
You know, the spread, which means that, look, you let your guard down, everybody's gonna get it.
Right.
Okay, so we've got to be very, very careful.
Right. I also think that a lot of people who've been vaccinated, and I don't know what the science is to this, perhaps the experts can tell us when we speak to them, but I think that many of those who have been vaccinated may actually be infected and are just acting asymptomatic.
Yeah, okay. So that means they're carriers.
Yes.
Spreading,
you see,
without knowing.
And I'm also curious to know, and again, it's very scientific, how, because at a point, if you were vaccinated and you went to any health facility with, say, a cold, a cough, any upper respiratory you know, and you even requested a COVID test, they'll tell you, well, if you've been vaccinated, the antibodies are going to show up in your test anyway, so we'll just treat you. So I'm curious to know how they are sort of distinguishing between a regular vaccinated person and then someone who is really dealing with COVID at this time.
And with the number of cases going up, I know very hardworking scientists at WAPKIP at Legon. So I'm just appealing to them. I mean, whatever kind of support that they need to call out for that kind of support. And then let government get it to them, because we don't, because the sequencing is not being done as frequently as it ought to be done. We don't know the extent of spread with the Omicron. We're just told that averagely, and that's from Ghana Health Service, heard from the Public Health Directorate, that averagely, I think for the past 1 week or so, we're recording like about 200 cases at the airport. 200 cases.
That's crazy.
But we need to do the sequencing to find out, to set them up, which of them is Delta, which of them is a normal strain, which of them is Omicron strain, so that we know how endemic the problem is and how to deal with it as quickly as possible.
Well, I do know that they're working really hard at the airports. I mean, I've had a few people I know coming in. Yesterday, for example, somebody landed in the morning and didn't get out until 4 p.m. because they were making sure that they were going through the motions. So, well, let's hope they can keep the fire burning, because more flights will still come in. People need to see their families.
Let's take a look at the Ghana Health Service website. Look at the current updates that we have there. Okay, so you can see there. We can see there the 321 new cases since the last count. Okay, 321 new cases. We have currently 3,165 active cases. And of course, we know that the active cases are basically those that are currently being diagnosed and are still being treated.
Exactly.
So they've not recovered yet. And then confirmed cases is just basically a total number in entirety since March 2020, you know. And then unfortunately we have 1,269 deaths, which in Ghana may seem horrifying, but on a global scale is actually minuscule, you know. Because people have 1 million deaths plus in their countries, you know. So
just a few days ago, the active case was below 1,000.
Yes.
Now we are
exactly.
And so we're over 3,000 now.
I'm just worried that
that's where the problem is.
I'm worried that if we keep if this rate continues, then that means that by next week.
We could easily
be doing 10 plus, 10,000 plus.
And I heard the Medical Association also speak about how the kind wave is affecting doctors and nurses. I heard the president say that the hospital where he works and he manages, as many as 7 doctors have had to go home because they are down with serious symptoms, and they cannot work. And if this is what is going around, then it means that even the caregivers are being affected. And that has ripple effect on what, because if you are sick now, and the one who's supposed to take care of you administer the medications, check on how you are doing, find out where you can live, whether you're responding to treatment, or that person is also sick.
Exactly. And let's not forget that this is a disease that, you know, attacks you hardest when your immune system is low. Where at the end of the day, a lot of people are tired. Many companies, businesses, outfits have been operating on skeletal structures, you know, so indeed because of finances, but also because you're still trying to make sure that some sort of social distancing is in place. So people are tired, exhausted, and their immune systems are also not up to par. But we have Dr. John Amuasi on the line. He's the group leader of Global Health and Infectious Diseases at the Amuasi Center for Collaborative Research, the KCCR. So let's speak to Doc. Doc, good morning.
Hey, good morning, and good morning to everyone in the studio and everyone listening this morning.
We hope you're doing well, despite everything that's just barging at us.
Well, quite all right. It's managing what to do.
Good. So please tell us, how scared should we be? I mean, we're seeing that cases are rising. Between Monday and today, we've seen about a 2,000 active case increase. We're being told that Omicron is in Ghana. We know it's more infectious, spreading more rapidly than any of the other variants. How scared should we be at this point?
No, thanks again for having me. I mean, you ask an interesting question. I mean, how scared should you be? Well, I'll change the question. I'll make it, how concerned should you be? Because, you know, being scared really is a whole different thing.
Ball game.
Exactly. So, but I think that, I mean, one should be concerned, and I'll explain why I say that one should be concerned. The information which we've received and the evidence on the ground across at least 3 continents, and particularly 2 continents, which is Africa and Europe, more specifically in South Africa, in England, and in Scotland. The research is showing that infections from Omicron coronavirus end up being less severe than for especially Delta and then all the other strains. But the degree to which the lower severity of illness and death is accounted for by the existing or pre-existing immunity, which one obtained either naturally via previous infection, and that which is obtained by immunity is not very clear. And this is where my take has been, that when you don't have the full picture, when things are not clear, and when you can tell that this is a virus that changes very quickly and also behaves in ways which are a bit unpredictable, then you want to be as cautious as possible. I'll give you examples of where decisions were made in the light of uncertainty, and it went the wrong way, and it didn't end well. We can start with the very beginning of the pandemic and what we saw in the UK. And I've explained time and time again how the UK opted to go for a herd immunity strategy, and saying that, okay, well, some people get sick and, you know, immunity will develop and we should just be fine. And this backfired really badly, and we saw the UK eventually becoming the epicenter of infections in Europe, with several people dying per day. At a point, you were having in the thousands of people dying per day. It was really catastrophic. They made a quick U-turn, and they were able to recover really fast, launching perhaps the most impressive vaccination program in Europe. And the benefits are there to see. We also saw a similar approach being taken in Norway, and it was so Sweden, and they paid a really heavy price for that. On the other hand, we've seen countries also take very, very high-handed measures, literally sealing themselves off permanently. I mean, North Korea has been totally impermeable. China also has been very difficult to get into, and it's beginning to hurt, not only in terms of the economy, but also the mental health and other diseases which would eventually invade the population on account of total isolation and not being able to address them. So there is that balance that one wants to establish. And as I said, with this Omicron, which spreads much, much, much faster, and it hasn't yet peaked, what you want to do is to err on the side of caution. And this is why I say that the move to mass vaccinate is perhaps our best shot at making sure that whatever impact that there is from this strain will be attenuated or mitigated to a large extent. There is hardly anything to lose at all from being vaccinated, but there is massive benefit both at the individual level and at the population level. For me, the narrative has changed. When you are vaccinated, what you're doing is protecting yourself and others from the possibility of getting severe illness and dying. It is very clear to me that, and this was said right from the beginning, that the Omicron is much more resistant, or when you're vaccinated, the protection that is conferred on you by vaccination is much lower with the Omicron. And I mean, if you would bear me out, I'm sure you know many people who are vaccinated who've come down with the COVID.
Absolutely.
But they've been,
absolutely.
Yeah, they've been. And I know someone who had the COVID and recovered, got vaccinated double, and was just fine, and then got the COVID again. And actually, their symptoms lasted barely 48 hours. 48 hours, I'm not saying they were negative after 48 hours, no. And by the way, all these tests, the COVID they had before and the COVID they had after vaccination were PCR confirmed. So it's not like they were just feeling ill. But the symptoms lasted just 48 hours. And this is the power of the vaccination. Of course, it doesn't mean they're negative after 48 hours. That's not what I'm saying. But they stopped feeling ill just after 48 hours, and they were much, much better going forward. So if this is what vaccination can do for you, it will prevent you from being in the hospital, prevent you from being on a ventilator, prevent you and your loved ones from dying, then this is the agenda that we need to push. I'm excited about the vaccination mandate that Ghana has put in place at the airport. It may sound draconian, but I think that's the absolutely right thing to do. And what I like to see right now is actually a booster program. A booster program for people who understand the power of vaccination and want to go for a booster. It would further potentiate the possibility of those sitting on the wall who've not had a first shot yet to perhaps agree to have a first shot. It would increase the immunity levels generally at the population level, and could spare us what could be a really bad wave of sick people in the next week or two.
Okay, so
it is very clear.
Dr. Amuasi, so not to cut you, but still on the towing the line of boosters. So we have seen cases where in the Volta region, for example, vaccines had to be thrown out because they had expired. People weren't taking them. Do we have enough vaccines now for, say, people who, or do you suggest or would you recommend that people who want the boosters should be given the vaccine so that they don't have to go to waste in the end?
No, you've hit the nail right on the head. And this is what I was actually saying elsewhere, that I wish that when those vaccines were expiring in the Volta region, and it was clear a week to the time, or maybe even 3 days to the time, that a booster program should have been open. That, hey guys, look, we've got this vaccine. If you want to get boosted, you're welcome to come here and get a boost. In that case, it would not have gone waste. I think we could have done better with those vaccines, but no point crying over spilled milk. What we do is we learn. The probability that some vaccines will move to expiry is high. And this is why I would recommend that at least a booster program be put in place. I wouldn't be surprised if it's in the works. In fact, I've heard from the grapevine that it is in the works, but we haven't heard anything yet. But I'm just advocating strongly for it, especially for our elderly population. Those above 60, I think, should be boosting by now. And anyone else who's willing should be boosting by now. It's not just a cliche, quite frankly, because the immunity levels go down after a couple of months. And if you have the opportunity to boost it up, it makes a huge difference, especially under circumstances where you may have vaccine going waste. So that would be my take on this. And as I said, thinking about the next 2 weeks with all the activity that's going to take place over this weekend and next weekend, look, I can just tell you point blank, there's going to be a deluge of unwell people. Now take note, I said unwell people.
Unwell
The
people.
degree to which they'll be unwell, the degree to which they'll be in the hospital, the number of people who would die, I mean, this will go up, but the degree to which it will go up, I don't know. If we can judge by anything we're seeing right now in all of the world, it will go up slightly, not catastrophically.
Okay.
We cannot tell. But you can avoid this. You can avoid this. So why not?
So, Dr. Amuasi, now I agree 120% with everything you've said so far. My issue is, how do we make sense of what some people are arguing about as far as a country case like Israel is concerned, where you're looking at a country that is over 70% vaccinated, and yet they're having such a massive spike in numbers, and they're using that as an argument against vaccine mandates?
Well, let me just put things in perspective. Now, Israel was among the first to start their vaccination program. They hit about 90% of their population being vaccinated with Pfizer. They did this very early. Now, at that time, the period of time for which one is protected was simply unknown, completely unknown. And you remember, I made a point that there's a lot we do not know, and we are learning by doing and learning as we move ahead.
Yeah. So
so we have these learnings from Israel that once vaccinated, it's not forever immune. First learning. Even at that point, the anti-vaxxers were against vaccination.
Yeah.
So it's interesting now they're shifting the goalposts and saying, hey, look at Israel, look at all these people who were vaccinated and now getting ill. It's proved that the vaccine, but well, before then you were saying vaccine is not good anyway. So that's not really your point. Now the evidence is that the immunity wanes, but then the immunity can be boosted, and ultimately the number of people who are sick and on ventilators in Israel, number of people dying, is so clearly much lower than in other parts of the world that don't have those levels of vaccination. So the evidence is in your face. So what you need to do, you need to unpack the evidence. We are changing the narrative, and we don't have to be shy about changing the narrative, because as I explained, we are moving into the unknown. It's like driving in the dark. You have your headlights on. Your headlights can only see up to a certain point. But as you move along, you see more and you see more. Well, you can't tell if there's a curve ahead, but when you get to a certain point and your light gets there, you can tell curve ahead, we've got to turn. Now we know there is curve ahead and we've got to turn. And the point is that we know that vaccination will not prevent you entirely from getting sick. It used to prevent you almost completely from getting sick, 94% in some cases. Now we can say, look, you may still get sick. You still get protected heavily. Your risk of getting sick is much lower than that of someone who's not vaccinated. But we can tell you with certainty that when you do get ill, you are much less likely to end up in the hospital and much less likely to die. That is the current narrative. And really, the anti-vaxxers just simply don't have a point, because they were against vaccination right from the beginning anyway.
And Dr. Amuasi, I think we also have to put into perspective the fact that, of course, the COVID vaccine is not the first vaccine we've had ever in the world. And usually when you do get vaccinated or inoculated, you're given a time frame within which you have to go for a revaccination or a booster or whatever. And I think we're looking at the same situation here, because just as you're saying, immunity will wane. And I think the anti-vaxxers haven't understood that we're not saying the vaccine is the cure-all, but it's a sure way to make sure that our hospitals are not pressured.
No, absolutely. I mean, the anti-vaxxers, I mean, the evidence is right there in your face. Viruses are different. They act in different ways. There are some viruses for which, once vaccinated, always fine, and others for which you need a boost. For example, in North America, you have your annual flu shot. This is because the virus is always slightly different year on year. And so they manufacture the flu shot or the flu vaccine, now let me use that word, vaccine, which is specific to that strain of flu for the year. And this has been going on for decades. Every year you go for your flu shot. This is normal. It's nothing new. I mean, where were the anti-vaxxers then? All right. And then that aside, as I explained, we learn as we go. it used to be that for yellow fever, for which you have that yellow card when you travel, you were supposed to have a booster after 9 to 10 years. This has been the decades-long knowledge. It wasn't until barely, if I'm right, 3 or 5 years ago, and again, don't quote me, it was a couple of years ago, 3 or 5, I have to check, that the WHO came out comprehensively to say, once you're vaccinated for yellow fever, you do not need any more booster. But this is based on knowledge that has now come. And so the information has changed. So I'm a bit pained when people say, oh, they used to say this, now they're saying that. Well, we are saying that because we know better. Shouldn't we not be trusted even more now that we're saying we now know this? So actually, let's change to that. That's evidence that we're not just in to deceive people or just say things that are unknown, but we're actually working with evidence and with knowledge. And I think it's really a testament and should be a sign that should point to trust rather than just fables about vaccination and negative impacts thereof.
Okay.
All right, Dr. Amuasi, we really appreciate your time this morning. Thank you so much for your insightful inputs this morning. Dr. Amuasi is the group leader of the Global Health and Infectious Diseases in Kumasi, KCCR. All right, so Duke, very much some of the things that we mentioned earlier, and giving us a bit more of an expansive view on what it is that we're going through in the country.
Yeah, he said it. He said it all. Yeah, especially why we should take the vaccination seriously, because it looks like that's the clear way out of this. Other countries decided to. I mean, when there was no vaccination, took to certain strategies, public health strategies to get their population out of it. It backfired. And now with the vaccination in place, I mean, you virtually have no excuse not to protect yourself. It's because it's better to take the vaccination and know that at least you have some level of protection.
And the vaccines are free.
Yeah.
At least here, I mean, the vaccines are free.
Yes, it is. That's what it is for now. So unless you're traveling and that's a different protocol. But this general, go to Ridge Hospital, it's free. Just go get it.
Yeah, and I think it's because a lot of people are undecided. And I think the last time we spoke to him, he referred to some research that had been done by KCCR, where, of course, majority of the people they sampled said they were undecided because of things they had heard, whether the vaccine was safe to take and all of that. But if 6 million people, it would be good for the GHS to release, out of the 6 million people who have taken, how many people have suffered complications as a result of taking it.
And you can start with us. Because we're all fully vaccinated sitting on this set. And start with us.
No, they said that 3 years' time you suffer the impact of the vaccine. So anyway.
Well, anyway, let's get vaccinated.
Yes, I think it's important.
At this point, we stand more to lose if we don't. And you see, people are vaccinated and, like I said, are behaving like the asymptomatic people that we had in the early stages. But if you play with somebody who's vaccinated, you may actually get sick if you're not. Very sick and end up in hospital and possibly even lose your life. So I think at this point, even though there's still a lot of mystery around it, of something new we're dealing with, COVID is just 2 years old. In Ghana, we've had it for less than 2 years. Let's get vaccinated and play it safe. Let's go for a break. This is still Breakfast Daily. Welcome back.
Yes. The show is interactive. We do want to hear from you throughout the show. 0550-585832 is the number that we want you to message us on. We will read your messages here on air. If you happen to be outside Ghana, kindly prefix the number with +233. Of course, on social media, hashtag is Breakfast Daily. Now we're talking vaccinations. We're talking Omicron, or somebody said Omicron.
Somebody to say cron.
Oh, good Lord. Yeah. But we want to go to the Ashanti region and sort of find out what's happening over there as far as their situation, the management of their situation is concerned. We have, we're going to be speaking to Dr. Michael Roxon-Ejay, who is the Deputy Ashanti Regional Health Director in charge of public health at the GHS. Good morning, Doc.
Good morning.
How are you doing this morning?
Oh, we are blessed by God.
All right. So, Doc, can you give us a bird's eye view of what's happening in the Ashanti region? I mean, usually Ashanti will be fast on the heels of Accra as far as whatever is happening in Accra, the reflection of it will be seen in Ashanti. Are your cases also going up? How fast is it? Is there a concern for the Ghana Health Service over there?
Okay, thank you. Good morning to you.
Good morning.
Currently, the Ashanti region technically in the fourth week has maybe happened in Greater Accra. After the end of the third week, in week 42, that's around October, we usually recorded, or we are recording less than 10 cases per week until last 2 weeks, when we suddenly had 41, and about 4 times the baseline. And then last week we had 59 cases. And as of yesterday, this week we recorded 81 cases. So things are on the ascendancy, and the picture is not something pleasant for us. So.
Are there any strategies that yourself and your team are putting in place to, curb the rise that you're experiencing?
In fact, we anticipated this long ago, which is why the call for the December vaccination month was timely. But prior to the Ashanti region had done, we were doing a lot of advocacy to get people vaccinated, because we knew this could happen.
Okay.
Looking at what had started globally, and also the season in which we were in. So we have ramped up vaccination, and also intensify education on the protocol. And now we are pushing more into setting the system to pick up cases in case of in respect of those who be affected, those who have a moderate to severe disease. We are very prepared to pick up them. But we are doing more of turning the tap down, so that we wouldn't have cases by which we engage in stakeholders, promoting vaccination to ensure that people don't get infected in the first place.
Yeah.
Okay, so are people, open to the vaccinations? Are people actually going out to get themselves vaccinated?
Yes, for Ashanti region, we don't have issues with people taking the vaccine. As of now, we've hit close to the target we set to vaccinate in December. And cumulatively, as of today, we've vaccinated at least 15% of the population, the target population, are fully vaccinated, and 35% have received at least 1 dose. That is since we started vaccinating. And the campaign is ongoing to get more people vaccinated. So it is something that has caught up with the people, and we hope they maintain the tempo to ensure that we're able to bring down this pandemic on our hands.
Your numbers seem on the high side when we look at the national average for the vaccination. What is it that Ashanti region is doing that we need to know as a country?
Yes, for Ashanti region, one thing is our system mobilization is very strong, and the people themselves understand the vaccine, so we don't have much problem getting the vaccine. Secondly, we have many teams, and we move house to house. We employ multiple strategies. That's all clinics have vaccination points.
Okay.
We have teams that move actually to get people vaccinated. And we have this convenience vaccination arrangement where groups can call that, yes, we are a group of 10 or 15. We are this place. We want to vaccinate this particular day. And we make arrangements to go and do that at no cost. And telephone lines are dedicated. My line is my telephone line is a public line, so anybody calls anytime to the link to vaccination. And we've disseminated this vaccination site widely on social media, so everybody knows where to get vaccinated. So these are the things we believe are working for us.
Wonderful.
Wow, no, it's very impressive.
Yeah, very impressive.
Yeah.
And congratulations to you and your team. I mean, of course, the Ashanti region is different. Even though Ghana is one big country, the different areas of the country have different demographics and things work differently. But do you think that some of the strategies that you're employing can be replicated in other parts of the country?
you rightly said it, that it's context specific. So I wouldn't be able to judge that people should apply this. But if anyone tries it and it works in the area, that is fine. And for Ashanti region, it is working very, very well. And let me add that the media in Ashanti is super supportive, and I always off my hat to them. They are really, really supporting us and pushing the front. I wouldn't want to mention specific names, but some are even tagging along the vaccination campaigns, holding campaigns, holding by themselves. They organize huge campaigns and we only go to cash in terms of vaccinating people. So they're very, very supportive, and these are also helping us.
Wonderful. Wonderful.
Thank you. I mean, this is a really good, heartwarming update that we're getting from the Ashanti region. We really appreciate it, and keep up the good work. We're hoping that we can learn something across the country from what Ashanti region is doing, and then we can all be safe after the Christmas. Yeah. Thank you very much,
Thank you
Doc.
very much.
Thank you for having me.
Have a good day.
Right.
Yeah. So Sacrum is getting it right.
Yes.
Like Americans know how to do.
I have to say, I have to admit, I'm actually surprised and impressed to see this is happening actually, but a few weeks ago, when we were speaking with Hafiz Tijani, there was a gentleman who was on the set. He interviewed him, and he said, there's no issue with vaccination here. We actually are looking for them to bring it to the churches. He said bring it to the churches. Go where the people are and do it. And I think it's what the Ghana Service has done. And their numbers are, vaccination numbers are going up.
But clearly there's also been a lot of sensitization. So like Dr. Oxen just said, the people understand the vaccine. But you can't understand something if you've not been told about it, or you've not read about it.
I don't see the fuss about this. We've been vaccinating this country against the 6 childhood killer diseases, measles, polio,
fever, polio,
to the point that polio is now
eventually zero in Ghana.
We had the whole Kick Polio out of Ghana campaign.
So Ghana vaccination, I don't know why. Well,
so a lot. Let me just say this: a lot of the anti-vaxxer movement and mentality came from America.
Well,
yes, from a certain religious angle in America, and as and of course Ghana, anything that is coming from somewhere that is abrochiri is like, then it must be true, it must be right, and then you just swallow.
Being worsted by this,
well, of course they are.
People are taking their vaccines.
Yes.
You need to read in between the lines. Apart from that, it's good that in Kumasi people are taking the vaccines, But last weekend we were there, and I observed for myself that, I don't know if it's because you are taking the vaccines, but Max in the
no question about it.
Wear them in as much as you are taking the vaccine. Please wear the mask as well. It's very, very important. Yes.
Well, we have a statement from the Ghana Medical Association, and I want to read out, let's read out portions of the statement. Yes, definitely.
So COVID-19 and Christmas, New Year festivities. In the last couple of weeks, our COVID-19 testing sites and health facilities have witnessed sharp increases in the number of positive cases over the last 1 week, especially in the Greater Accra and Ashanti regions, with alarming daily positivity rates ranging between 40% to 50%. This escalation in cases is likely driven by the Omicron variant of the SARS-CoV-2 virus, which is highly proving to be more transmissible than the hitherto dreaded Delta variant, which dominated our third wave of COVID-19. This is a very worrying development which calls for concern by all well-meaning Ghanaians, especially as we enter the Christmas and New Year festivities with their characteristic mass events and celebrations that tend to bring huge numbers of people together. Ghanaians are therefore entreated to visit health facilities to get tested if they have any headaches, extreme fatigue, fever, and other flu-like symptoms, and as much as possible, Desist from self-medication, especially for unproven malaria. It is of utmost importance that that as we enter into the Christmas New Year period, we take these facts into consideration to avert a fourth wave. 1. The COVID-19 pandemic still poses an existential challenge to the health of all persons living in the country. 2. The escalating of cases of the disease is not checked, if not checked, has the potential of further awakening or weakening our already fragile health system. 3. The non-adherence to the preventive measures, especially during this festive season, has the potential to further escalate the spread of the disease and its attendant consequences for individuals, families, and the country as a whole. 4. All Ghanaians should take advantage of the Ghana Health Service. For that matter, government's drive to vaccinate all Ghanaians of age 15 years and above. 5. The GMA also calls on central government, the Ghana Police Service, all metropolitan municipal and district assemblies, MMDAs, as well as the Ghana Tourism Authority to strictly enforce all COVID-19 protocols at all events and celebrations and bring all offenders to book without fear or favor to prevent a potential deadly fourth wave of COVID-19 in the country. As a matter of urgency, social activities such as parties, nightclubs, church services, market activities, funerals, and other mass gatherings of such nature should be regulated or restricted. Failure to do this may have dire consequences for all of us come the year 2022. 6. Government should also ensure prompt, continuous, and adequate supply of distribution of PPEs to all health workers in the various health institutions. 7. The GMA calls for an urgent scale-up of COVID-19 testing and contact tracing for all positive cases, as well as strict isolation and management of all infected persons to help break the chain of transmission. 8. The Ministry of Health or Ghana Health Service and the National Commission for Civic Education should relaunch and intensify COVID-19 education. The GMA also urges all media houses to continue their good work on COVID-19 public education till the virus is defeated. And 9, the GMA entreats all Ghanaians to take their personal safety into their hands by adhering strictly to all COVID-19 safety protocols as we celebrate the birth of Christ and the New Year. We wish Ghanaians the best of tidings for the Christmas season and a prosperous New Year. Do your best to stay safe at all times. And of course, it's signed by Dr. Frank Cerebro, the president of the GMA, and also Dr. Titus Bayu, the general secretary. So there you have it. The GMA has spoken. When the GMA speaks, we need to take it seriously.
But I like the part where they said that the events you either regulate or you restrict.
Yeah, right. Regulate or restrict. Important. And also calling also on the police.
Yes.
And asking for people to be called to book if they are not following the protocols as they should. Yeah. So let's just keep all this in mind. And of course, once again, go out there and get vaccinated. The vaccines are available. If we don't take them, they'll be thrown away. You're not going to pay anything for them when you have to walk into a center to get them. So please do take them. And if you feel ill, please report to hospital. Don't stay at home and be drinking all sorts of concoctions. Even though that's good because boosting the immune system is also important. But don't use that as a replacement for medical care and attention. Please go and get yourself tested. Very, very important. Especially because, once again, we're saying that some people may not exhibit dire symptoms or end up in a hospital bed. But because you don't go and get tested and know your status for sure, you may end up infecting someone else who may lose his or her life. Let's be responsible, please.